Good evening, everyone, and thank you for coming out for this forum. This has been a request of, actually it started with Reese Siegel, and then it has branched out to a couple others from there. It is a little bit challenging because of the spacing requirements and the maximum capacity in the room. Tonight, this panel, which we'll introduce shortly, are here to hear your thoughts and commentary. It is not really a question and answer session because we need to hear what you think and what you feel. The officer that's at the door is will let us know if there are more people that want to come in. Should there be more people that want to come in, after you speak, we would ask you to say all that you want to say and step out so that somebody else, if there is somebody else, has the opportunity to come in. If you want to wait and then see if there's an opportunity to re-enter later, that's fine. If not, not. But we are supposed to have 25, so we got 3, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, sort of. So I'll call that 25. How's that? I'm not booting anybody at this moment. So that's how this was planned. It was requested. We have received, I think 3 emails from, some that could not attend tonight, that want to be recognized as well. So with that, I will ask I'm going to start on this side. Key your mic, and then say who you are, what you represent, and then shut your mic back off, please.
Good evening, everyone. My name is Vince Scarpetti. I'm the superintendent of schools in Orange.
Evening, everyone. I'm Robert Gagney. I'm the chief of police.
Good evening, Max Martins, Assistant Chief of Police.
Good evening, Ralph Okenquist, Board of Selectmen.
Good evening, John Carangelo, Board of Selectmen.
Good evening, Margaret Novicki, Board of Selectmen.
Good evening, Mitch Goldblatt, Board of Selectmen.
Good evening, Brian Slagowski, Chief Sanitarian with the Health Department.
Good evening, Vaughn Dumas, Fire Chief, Orange Fire Department. If I could just take a minute, thank you for all your support. This is our 95th year of service to the town, and without the carnival, we did get a real outpouring of support for our fund drive, so thank you to the community for doing that.
Good evening, James Vincent, Fire Marshal.
Thank you. So now that you know everybody's sitting in the room, I will ask, and I know there's many of you here, relax, Sylvester. It's a good thing you don't have that button like Jeopardy. We will ask that you state your name and address on the record there so that Ann afterwards, when she has the minutes, in case she misses anybody, that's a sign-up sheet that's right there on the podium. Thank you. I couldn't think of that. This is being broadcast live, I believe, as well as being recorded by OGAT. So with that said, who would like to express their thoughts first? Very good. No, we'll let the audience go in. Dr. Amir, you can come up here.
Thank you very much, Mr. Zioli. By letting Filipinos come up first, I think we're starting out in the right way. Good evening, everyone. My name is Sylvester Salcedo, S-A-L-C-E-D-O. I live at 851 Shagbark Drive with my family. This evening I wanted to come very briefly to try to attempt to share with you just my initial reaction on reading the news about the initiative put forth that Orange, Town of Orange, should join the other towns that I believe have already been reported on as having signed on to a concept of race being a matter of public health matter, or a public health emergency or something.
Crisis, they call it, racism is a public health crisis, is the title.
Racism is a public health crisis. Now, personally, I don't necessarily think it's a public health crisis, but I do believe that it is a community issue that we as a town should address, and I would certainly, excuse me, sign on as a resident and fellow citizen of Orange to help in this effort. And this evening, I just want to share that before my family, or my wife and I moved to Orange, we actually lived in Bridgeport, where I had lived for about 5 years in an affordable housing complex, which, if anyone is interested, I'd be happy to share what that experience was like, and I believe that it would provide a foundation or a platform on which we here in Orange can entertain and learn from. Now, I want to fill in the background that actually, before that period in my life, I was married to the highest paid public servant in the city of Bridgeport, the superintendent of schools. I believe her name was Dr. Sonia Diaz Salcido, is well known to our current superintendent here, Dr. Scarpetti. So I went from being the husband of the highest paid public servant in the city, the biggest city in Connecticut, to living in a affordable housing complex. But that story in itself is actually something that I'd like to be able to share with you so that we can all learn, and actually, hopefully it can act as I said, a way to be able to usher in this discussion in a community-wide manner. So that's all I'd really like to share with all of you tonight. I gotta run back and take care of the kids, so thank you very much for your time. And as I said, I'm available.
Your kids are getting old enough to take care of themselves now.
They will be taking care of me pretty soon. Thank you all, and as I said, Mr. Zioli has my number, and all of you, Mitch, you have my email. Call on me, I'm ready to help. Thank you all.
Thank
Good
you,
night, and
Sylvester.
let somebody else in.
Yep, thank you. Thank you, Sylvester. Okay, is there another person in the audience that is prepared to speak of their thoughts and opinions? Risa Siegel. You weren't as quick on the buzzer as Sylvester, you say. On Jeopardy, they have a buzzer, and that's why I said you weren't as quick on the buzzer as Sylvester.
I'm Risa Siegel. I live at 571 Arrowhead Drive in Orange. Race is a public health crisis in the United States. Why should the town of Orange care? Many towns and municipalities in Connecticut have already stepped forward and declared that race is a public health crisis. If enough towns and municipalities across the nation step forward, hopefully action will be taken on a state and national level to address this embarrassing situation. It is embarrassing that the wealthiest, most powerful nation in the world has statistics that show that black women are twice as likely to miscarry in pregnancy. Black Yale graduates in the class of 1970 were 3 times more likely to die at an early age than their white classmates. White men with a high school degree live longer than black men with a college degree. In this year, black and Latino Americans are about 2 to 3 times more likely than their white counterparts to contract the coronavirus, 4 times more likely to be hospitalized, and almost 3 times as likely to die from it. And of the 121 children who died from the virus through July of this year, nearly 80% were children of color. Racial health disparities are neither new nor unique to this pandemic. Black and Latino Americans have faced higher rates of chronic illness and infant mortality for generations. Housing, immigration, education, and labor policies that date back to the beginnings of the United States are part of the cause. But the stress of being the target of racism has been proven to increase the likelihood of contracting high blood pressure, heart disease, kidney disease, and obesity which explains the basis of much of what has been quoted. Thurgood Marshall said, "We must dissent from the indifference. We must dissent from the apathy. We must dissent from the fear, the hatred, and the mistrust. We must dissent from a nation that has buried its head in the sand, waiting in vain for the needs of its poor, its elderly, and its sick to disappear and just blow away. We must dissent from a government that has left its young without jobs, education, or hope. We must dissent from the poverty of vision and the absence of moral leadership. We must dissent because America can do better, because America has no choice but to do better. For Orange to take a public position, whether or not these problems are considered local, is a powerful step, because we are all Americans."
Thank you. Chris, if you could drop those microphones down, not everybody's as tall as you or I, and it will pick up a taller person, but it's not picking up necessarily shorter people. Okay. That should help a bit. That's good. That way you'll cover it. Thank you. Okay, is there somebody else who is prepared to speak from the audience on this issue? Yes, ma'am. Name and address for the record, so Ann will know who you are when she hears the tape after.
My name is Suzanne Anderson, 174 New Haven Avenue, Orange. May I hear again the wording of what
Racism is a health crisis.
in the town of Orange?
Well, it was presented to us as racism is a health crisis. The purview of the Board of Selectmen is only to the boundaries of the town of Orange. However, other communities have also adopted this, and I think they're trying to achieve a group of communities that they could say have adopted a resolution towards this effect. But as far as for us, it's, yes, the boundaries of the town of Orange.
Well, I think that's fine for towns that think they have a problem. I'm against this. I just don't know what, are we trying to say we have I just don't understand it. I've lived in Orange all my life. I think everyone is welcome. I think this goes back to a lot of religious beliefs. If you love, I think all lives are valuable. All people are valuable. Unborn children are worth saving. I back the blue. I think, I just don't understand it. I would be against such a thing. I think it's just unnecessary at this time. Thank you.
Okay, we thank you for your thoughts. Sean, are there still people waiting outside?
Yes, sir.
Okay. Yes, ma'am. Name and address for the record so that Ann knows when she does the minutes.
My name is Ruth Friedman. I live at 266 Courier Drive. Been an Orange resident now for just over 21 years, and I hate to admit this is my first attending this, so.
Well, welcome.
Thank you. I may come again.
Don't be nervous.
We'll see. I come because I'm in support of the resolution. I'm in support of the resolution not only for Orange, but Orange is part of Connecticut. There's no question that racism is a public health issue. It's a public health issue on a micro and macro level. Whether we see it or not is the question, and whether we start looking. And looking can be very scary. You don't know what you don't know. You don't know what you don't ask. But the statistics that were presented before give us something to think about. Here's another one. As we're all waiting and hoping for a valid vaccine, a well-tested vaccine, Right now, one of the things that is going to hold up releasing vaccines is that the laboratories, the pharmaceuticals, can't find enough people, minorities, willing to volunteer to be part of the tests. Minorities are, are being affected by this more than Caucasians. There are some understanding why, there's some not. To make the validation for the FDA effective, you have to get people of different backgrounds willing to be part of the trials. Why won't minorities be part of the trials? Because they're afraid of authority, because they don't get good medical care, because they're not sure if somebody's going to take down their names and numbers and maybe look into their background and not let them just be part of this. So there have been a number of stories, including in Pittsburgh, where the University of Pittsburgh medical staff, public health, are out looking. How is that going to affect us? Well, first of all, is there anybody here who has proven that there's no one who's not Caucasian who is afraid or not afraid of going to the town meeting, of going to the police, of going to seek help? Simply asking the question may open up things that that we wish wasn't true. Just because we wish it doesn't mean it is. Do we need to wait? Do we need to wait until we have a shooting, a riot, a mistaken identity, somebody who's desperately sick because they didn't get the care because they're afraid to reach out to it? Or should we acknowledge that in a town that is largely Caucasian, supported by a group of people who are largely Caucasian, that maybe it would be a good thing to ask the question? And if we come up with the answer, which is no, it isn't an issue in Orange, that's good. That would be a very good thing if we asked and we thought about it and we all started to educate ourselves about it. There's a group suing the town of Woodbridge right now over racial issues. Certainly there are racial issues that have gone all the way to the Supreme Court, emanating out of the city of New Haven. It's hard to believe that our little town is completely immune from it. And wouldn't it be great if we could get up in front of it and have a dialogue about it? It's in the news. There's no reason we can't be thinking about it. I come at this from different perspectives. I'm a child of the 60s whose parents brought her to marches. I hope that it's only your masks that are, hiding your horror, as you all think she couldn't possibly be that old.
Very good. Touche.
I grew up in a mostly white liberal town in Westchester County, New York. I went off to school, grad school, and was a history professor, taught early American history. I lived in Wisconsin for a while teaching. I came back. I'm now a lawyer. I'm not a litigator anymore. I'm working in-house. I'm the mother-in-law of a Cuban African man who is a New York police officer, married to my younger stepdaughter. I have two gorgeous grandsons who are of mixed race. I don't know what's going to happen to them as they grow up. And I want to be able to tell them that SAFTA, which is what they call me, did everything we could. And real dialogue is the first thing we can do. So I thank you for holding this. I saw in the paper that you said you had only received 2 emails on
3
this.
for tonight.
Yeah.
Yeah.
You'll be receiving one from me too as a follow-up. And I think what you're doing is an incredible first step. So thank you to taking this on.
Thank you. I will tell you this, you are more than welcome to send an email, which could go into the record if you so ask, but you will be in the record because you've been recorded and you are on record, so you'll be in the minutes. So, but you're more than welcome.
But I don't get royalties?
You don't want them. Have you ever watched OGAT? Thank you very much. What's the matter, Chris? Oh, it dropped. Yeah, okay. Probably might have gotten bumped, too. Okay. Is there anyone else? Yes, ma'am. Never quite sure with the masks on who a person is until you hear their voice now. There's some that are distinctive and some that,
Well, mine is distinctive,
yes.
Jim. Good evening, everybody. I am Nancy Bensavango. I live at 409 Tolman Road in Orange. I'm a proud lifelong resident of Orange, and I'm also a proud employee of the Orange school system. I wanted to come out tonight because as I learned, I think, from one of the last meetings, that the issue of racism as a public health crisis and having Orange take that stance was presented. While I do believe that racism is a public health crisis, I want to know what the action plan that would go with making such a statement is. I've always been taught, don't talk the talk unless you're going to walk the walk. So I want to know what is the plan that people would put forth in order to address this. I believe racism has no home in Orange, and I believe that the community that we live in embraces that thought, and that we all truly believe that racism has no home in Orange. But in order to identify it as a public health crisis, I would hope that we could be presented with a very sound action plan so that we're not looked at as a town that wanted some political publicity or attention without actually planning to take some sort of action. So let's not make the statement unless we're going to do something to support it. Thank you.
Thank you. At this time, it's just gathering information of what people are saying so that as this evolves, that is a possibility. We just don't know what that is at this time. So that's the reason for this tonight. Is there anybody else in the audience who would like to speak? Who's next? You've been sitting, waiting patiently, cupping your ear to hear some of the speakers, Mr. Spiewak.
Hi, my name is Bruce Spiewak. I live at 945 Red Fox Road, where I've lived for about 4 decades. And I'm here to support the concept that the Board of Selectmen address this issue officially as a board, because I feel it is an important issue, and it extends across races and religions and politics. And I think that ignoring it is wrong for the town of Orange and for the Board of Selectmen. That's all. Thank you very much.
Thank you for that. Is there anybody who would, Mary? It is you, okay. Sean, is there anybody else out there that would like to come in? I think we have some room now. Can never be quite sure who some people are until you're looking. Could it be?
How did you tell it was me?
I think it was the orange top.
I might be that, yeah. Mary Welander, 377 Dogwood Road. Did that get on?
No, that wasn't you. It was for,
Okay.
you're fine.
Inclusive communities are successful communities. As a resident mother of 3 school-age children, an elected official, and as a state representative candidate for Orange, I am deeply committed to the success of our community. I respectfully urge the Board of Selectmen to take up this important conversation. Let us be a community that is known for its strong schools, history, and natural beauty, and also for being open to learning through respectful, thoughtful discourse. Thank you.
Thank you. Is there another person ready to speak? You come to the podium, name and address for the record, so Ann knows who you are when she tries to decipher it later, or you can write it on the list there.
Okay. My name is Marjorie Shapiro. My husband and I have lived in Orange for 43 years, very happily and very pleased with our community all these years in many ways. I believe very strongly that racism as a public policy, as a public health issue is a very significant and important issue that should be discussed by the Board of Selectmen and by all members of our community, because the world is affected by this issue, the United States is affected by this issue, and small towns are affected by this issue. We may not have very many minorities in our town, but that doesn't mean we're not part of this problem as anyone living in this country. So other towns in Connecticut have taken it up. The Board of Selectmen of other small towns, you may have heard someone else say it, Easton and Bloomfield are two examples where it's been taken up by the Board of Selectmen. I believe that we can make progress on this subject through education, and therefore involve our Board of Education of both Orange and Amity, Police Department, Fire Department. The entire community should be involved in discussing this subject, which is a very real and huge problem in this world. Thank you.
Thank you very much. Is there anybody else who would like to speak? Betty Hadlock, I thought you weren't coming tonight, but I saw you charging in, so we have your email, but now you're here in person.
Betty Hadlock, 305 Goose Lane, Orange. I've lived in Orange for 39 years. As our local population becomes more diverse, I believe it's essential that we ensure all residents of the town of Orange receive the services that they need and deserve. National data consistently shows that unfavorable outcomes in healthcare, housing, and job opportunities are inherent for citizens of color. Therefore, I believe that further discussion and investigation into racism as a public health crisis is needed at this time in our town. Thank you very much.
Thank you. 5, 6, 7, 8, 9, 10. Okay, we're still good. Yes, sir. Oh, it's Kevin, isn't it?
Yeah.
He's behind Hecky, I can't quite tell. Sean, I think you have ability for maybe 2 or 3. No, just speak to it where it is, Kevin.
Yep.
It'll pick you up.
Okay. Thank you. Hi, my name is Kevin Hadlock. I live at 305 Goose Lane. I've been a resident of the town of Orange for the past 39 years. In that time that I have lived here, my wife and I have raised 4 children through the Orange as well as the Amity school systems. All 4 are now healthy, living on their own, with families to raise, and doing well. They received high-quality educations here in Orange as well as at Amity. However, there's no question in my mind, just from my own personal observations, that the town has become increasingly diverse, and I'm talking about racially and ethnically diverse in the past 4 decades. And I think that's a very good sign, and I hope it continues. However, on a national basis, and let's face it, every one of us here is an American, the outcomes, and I'm talking about medical and health outcomes, and access to health care are inferior for those who are not white. And that is true in the town of Orange. It's very true in the state of Connecticut, which has some of the widest diversity in terms of medical outcomes and financial resources in city to city or town to town as anywhere in this country. And therefore it is also true throughout the United States. So it is important for us to consider this resolution. It is resolved that racism is a healthcare emergency or crisis in the town of Orange, just as it is in the state of Connecticut, just as it is in the United States of America. And I certainly hope that the Board of Selectmen will duly consider adopting this resolution so that we can take the appropriate action to make this resolution no longer true. Thank you.
Thank you. Is there anybody else who, yes, ma'am?
Hi, my name's Carla Eichler, and I live at 267 Hunting Hill Road. I grew up in town. My family still lives here, and about 10 years ago, I moved back with my husband and my 2 children that now go to Racebrook School. And I come here tonight because I love this town, and I think that this resolution is a really interesting opportunity for us to open up a little bit of a dialogue about some of the newer issues. In the past 10 years since we've been in town, the towns have become much more diverse. And it makes me so excited that my children get to go to school with other children of different backgrounds and different race and ethnicities. However, we do know that this is an issue throughout our country. There is lots to read and to study about this issue, and I think that it's important that we educate ourselves and to understand how this might affect the people that live in our town. I think that making this declaration would help guide our community and our leaders when there are decisions that need to be made regarding policy in terms of public health, but maybe also education and housing and other things that affect the people that live here. And I think seeing problems that may come up in our community through a lens like this just help us understand what people in town need. I hope that if this declaration is made, we as a community can feel more comfortable addressing uncomfortable issues like this. And it's not any criticism about our town, because we live in a beautiful town with amazing people. And it's only to improve and make things better. So I urge you to consider and to continue the conversation. Thank you.
Is there anyone in the room that would like to speak? No. Yes, ma'am. Go ahead. Don't be bashful. That's why we're having this meeting. Sean, are there still more people outside? Okay. I think you got room for a couple.
So my name is Harley DeMatteis, and I live at 284 Pine Tree Drive in Orange. I wanted to talk about my experience going through the Amity school system. I graduated in 2018, and sure, it's not just Orange residents that attend Amity. In 2019, Amity students protested against racial injustices perpetuated by the Amity administration. They had had enough. I graduated in 2018, as I said, and although due to my privilege, I will never know what it is like to be affected by racism personally, I can attest to racism being prevalent within this community and the Amity community, because not only did I see and hear it happening every day, but because I am guilty of having carried out racist language and thoughts as well during my time in the Amity school system. Not to blame the school, but only myself, but I cannot recall any efforts by anyone of authority to have put a stop to it. I was never called out. I was never disciplined. If they did make efforts to stop it at a school-wide level, maybe they did, and maybe it just didn't strike me, because I'm a white kid from Orange, Connecticut, so why would it have? First Selectman Jim Zioli said that racism is a worldwide issue which is far from the scope of the duties of the Orange Board of Selectmen. But this is a systemic issue, and the people with power and influence and privilege at the top, such as yourself, have the responsibility of putting it in your scopes and doing the best you can to address and combat it. I strongly urge for this to be put forward in a way that, looking around in the room today, It is apparent that there is not enough representation, and it's kind of embarrassing to see so many people who wouldn't even be affected by this firsthand possibly making a decision about whether to declare racism as a public health crisis. That's all. Thank you.
Thank you. Is there anybody else that would like to come up and speak at the podium on this? This is for your opinions and thoughts and how it affects the town of Orange. The Board of Selectmen are only able to deal with to the boundaries of the town of Orange. Is racism a problem that you feel or not within the town of Orange? Do you feel that the resolution, anybody who has seen the resolution, it leans, and we'll probably all have our own comments on it, it leans only in one direction, and I think there's more directions to lean in with this tree than the one direction that the resolution that was put forth leans. But is there anybody else here that would like to speak on the topic? Yes.
My name is Tom and Jai. I live at 51 Center Road Circle. I've spent the better part of a day trying to figure out if I could or should say anything at this stand. And I guess I don't have a script. I guess the only thing that I can say is that I feel hurt. As a member of this town that I love, that there is a possibility that the people who are supposed to be looking out for me are not acknowledging the pain that I may feel as a person of color living in this current climate of the United States of America. It pains me that people have the privilege to come up to this podium that I'm standing at right now and say, I don't think that this resolution should be passed because it would rock a boat. But people like me are already quite uncomfortable, and there's a conversation that needs to happen. There's so much that needs to be said. There's so much that needs to be done. And to be able to come up here and say that problems like mine aren't real is very ignorant, and it upsets me greatly. When someone falls by the side of the road, the decent thing to do is to ask them what's wrong, to acknowledge their pain, to listen. And it feels as though there are those who are not being listened to. I agree with the sentiment that all lives matter, insofar as people of color's lives matter too, and that must be acknowledged as a separate fact. Not all lives matter until Black lives matter. Not all lives matter until people of color's lives matter. I think that's all I need to say, sorry.
That's quite all right. You did very well. You were nervous. That was very good. Is there anybody else in the audience who would like to speak on this topic? Racism is a health crisis. The Board of Selectmen can go to the boundaries of the town of Orange, is what our resolution is. Other towns have done it. Orange is hearing people's thoughts and considerations on it. Sean, is there anybody else still outside? Okay. Is there anybody who wants to come back in? We do have room if some are hanging around. If not, that's okay. If not, I'm going to ask if there's anybody on my, no, let's see if anybody comes in first. Maybe not. Okay, is there anybody at the table that would like to say something? If not, you're not required. Tonight was gathering of information. Margaret wanted to speak in the beginning, but no? Okay. So Margaret, I'll offer you the spot first.
Thank you, Jim. I'd like to share a little bit, sorry.
Wow.
I didn't know my voice was so strong. I'd like to share a little bit of the background to this forum and to this issue, and why I support Orange taking it on in a positive way. I and my colleagues proposed to have a discussion on racism as a public health crisis and to pass a resolution declaring it as such as an agenda item for the past few Board of Selectmen meetings to really allow us to open up this conversation and take action. We want to join the growing number of towns and cities across Connecticut to do so. Our first selectman has invited us to this public forum first to gauge public interest in this issue. I believe everyone has an interest in combating racism. Why do we need to talk about it here? Is it a problem in Orange? We need to look at it because there are deep structural inequalities in this country that have to be addressed. We need to look at it because racism exists in our country, our state, our town, everywhere. African Americans have suffered from institutional structural racism for centuries, first as slaves bought and sold as commodities with none of the basic human rights that we all hold dear. Denied the right to be educated, to own land, to vote, and it wasn't until 1965 that the Voting Rights Act was passed, banning various discriminatory voting practices. But look, we see efforts at voter suppression going on right now, today, right now as we lead into this election. So clearly these problems have not been solved. Clearly discriminatory laws and practices, such as Jim Crow segregation, have impacted not only where Black Americans live, but the quality of their lives, their education, their employment options, their income levels, their health. Today, Black Americans die at a higher age-adjusted rate than white people from 9 of the top 15 causes of death. And the age of COVID has exposed health inequities all the more. Black and Latino people are 3 times more likely than white people to contract COVID, 4 times more likely to be hospitalized as a result, and 3 times as likely to die from it. So it's time to acknowledge that racism persists in our country and take steps to address it. Many other towns and cities in Connecticut are doing so, and this is our first step here in Orange to open the dialogue. I hope this forum will lead us to the next step. And also once we pass the declaration, taking an honest and clear-eyed look at our policies and practices on housing, on schools and curriculums, on provision of community services, on hiring and employment, on food security, and on health, to see where we might need to do better. As a selectman, I consider it a duty to all our citizens to move this dialogue on racism forward. And personally, as a woman with an African husband and a mixed-race son, it is critically important to me to see real and meaningful progress on the road to eliminating racism in America. Let's set an example and do all that we can in Orange. You can't solve anything that you don't admit exists, so we need to start the conversation. Thank you.
Is there anybody else at the panel that? Mitchell, I know.
There's a few emails that you mentioned came in. I think people would ask for them to be read if there was
Yep.
time. Do you want to read them? You want me? I have a couple of them
Well, I
here.
have them. I was
Okay.
going to do it after. I have.
Fine, that's what
I
I
have,
wanted to say.
well, let's make sure we have the same ones. I have a Jody Deach email.
Yep.
A Will Sherman email,
Yep.
and a Betty Hadlock.
But I think Betty basically read her email, so
Yeah.
we really have two to go. You're right, there's
Okay.
the two, I have same ones.
Okay. So you're not going to, I thought you were going to speak on something else.
I'll speak briefly. I'll speak briefly because it's hard to follow what Margaret just said. But this all started, for those that don't know, it started with an email to Jim and myself and Margaret and a few others saying we should have this discussion before the Board of Selectmen. It's come up at the last, at least 2 or 3 Board of Selectmen meetings, and Jim agreed to have this forum, and I think it certainly has opened my eyes to things in this town, and I'm glad we've done this. I think it is the first step, and hopefully not the last, as we move forward in this discussion. And in the last several weeks and months, I have read more, learned more, and experienced more about racism as a public health crisis, racism as it exists in this country and in each one of us, as an institutional racist policies that they're out there, and how each one of us has that inherent racism in us, whether we realize it or not. And it's there, and I think the sooner we recognize it, the sooner we can make strides to help eradicate it. Thank you.
Okay, I think there are a lot of possibilities that could change and all. As I already said, I personally, as I read the resolution as it was forwarded as a template, I think it leaves things out, I guess is the best way I can sum that up. I find in meeting an awful lot of people that live in this town, have lived in this town, may have just moved to this town, people that have worked hard, are happy, and are happy with the town of Orange. And I do get my fair share of complaints. Mitch got them before me, and I think as life goes on, they get stronger. And I would hope that if there is a problem, whether they go through community services or go through the Board of Education, has staff that handle those things if it involves children. I will say the one young lady who spoke here going through the high school system having problems, I've heard of more challenges up there than probably anywhere else. I've heard of problems up there, whether it be the color of your skin or the religion you follow or how you dress, and that list can go on and on and on. It's unfortunate up there, but, you know, kids as they grow, hopefully learn right from wrong and grow through. Some do and some don't, and I think all of us in this room know that. We will take under consideration at some point some more information that's forthcoming. I don't know as within the bounds of the town of Orange if, and there are some ways that you can marginally find out if there are issues as far as receiving health care and things like that. I do believe there are problems in that area, but I don't believe that it is just with one specific group. I think there are others that fall under that umbrella through many different reasons that face difficulties, whether it be health care or housing or any of those issues. I think Orange has made some really big strides in the last few years to offer multiple housing types, and there's more to come. One speaker referenced Woodbridge. They're not in a lawsuit at this time. There's some lawyers that have filed a zoning application that have threatened, if denied, they may appeal the decision of the zoning in Woodbridge. There's a lot more to that than just what's on the surface of that onion. As you peel the onion back, there's going to be a lot more things that come out of it. Same as in Orange. I mean, if you don't have sewers, it limits the density by state public health code and things like that. All of you who have septic systems will understand that. If you have put a septic system in, you already understand how much money you threw in that hole in the ground, and if you haven't done it yet, get ready. Others have practiced and prepped for this meeting tonight. There were other private get-togethers to prepare some for possible questions or commentaries for tonight's meeting. Not everybody at this panel was privy to that gathering, but some had that opportunity. So there's many variables out there that we see. We did get, let's see, well, Betty Hadlock is here, and she has also submitted an email that she wanted read into the record. So you will be in the record, Betty, but since you pretty much spoke it, I'm not going to read it. I understand. And then the second was from Will Sherman, who was unable to attend tonight, and I'm emailing you on the matter I consider to be quite important. That is the resolution declaring racism as a public health crisis. I'm asking that this item be placed on the Board of Selectmen agenda and thus open to community input, discussion, and vote. I'm also asking that my email be read aloud and into the Board of Selectmen meeting minutes. Well, it's this forum, and then everybody will have it as part of the minutes of this meeting. Declaring racism a public health crisis is a movement that has recently spread across a number of states and communities. The American Public Health Association, American Medical Association, American Academy of Pediatrics, American College of Emergency Physicians are among organizations calling racism as a public health crisis. But this isn't a new idea. Public health officials have identified racism as a public health issue for well over a decade. As a retired, professor of health psychology at Southern Connecticut State University, this issue was one of the major topics of discussion in my course. The American Public Health Association says that what we're hoping is that by thinking of this through a public health lens, it will help people recognize that racism actually hurts people. It impacts their health in a negative way. When health experts talk about racism as a public health issue, they're referring to the ways racism affects people where they live, where they go to school, the quality of the air they breathe and water they drink, their income and wealth, and their access to quality, healthy food and health care. As just some examples, black women are nearly 4 times as likely to die of pregnancy-related causes than white women. Black people are more likely than white people to experience high blood pressure, diabetes, stroke, and now during the COVID pandemic, people of color are more likely to have pre-existing conditions that increase their mortality. And in a recent important study, researchers from George Mason University published an article in the journal Proceedings of the National Academy of Sciences analyzing data from 1.8 million hospital births. One of their more startling findings was that black newborn babies in the U.S. were more likely to survive if their care came from black doctors, but 3 times more likely that white babies to die when treated by white doctors. I think there might be a bump in that sentence, quite honestly, but that's how he has it written. Making this declaration is the first step. Acknowledging and identifying the problem is just the first part of trying to find a solution and spur necessary change. Let's have Orange be a leader. Thank you, William Sherman, Ph.D. That's Betty Hadlock, right. This one's from Jody Deach. Jody Deach, Jim and the Board of Selectmen, thank you for planning the forum on racism as a public health issue, where I believe this should be on the Board of Selectmen agenda. This is certainly a next step toward that and towards a declaration in Orange. My reason for writing is that unfortunately I will be out of town celebrating my 30th wedding anniversary and will not be able to attend the meeting. I did not want my absence to be misinterpreted in any way. I am writing to encourage this body to take up this issue at a regular Board of Selectmen meeting and asking that my email be read into the record of the forum and included in the minutes, assuming minutes are being taken. Declaring racism as a public health issue in Orange does not mean anyone is saying racism is a rampant issue in town, but is saying that we understand there is an issue and that racism does contribute to health issues among minorities. The AMA and other medical associations concur that there is evidence of racism as a public health issue and that it is not just based on socioeconomic status. Just the stress of being a minority in a predominantly white community is a contributing factor. One might ask why minorities are not the ones speaking out. I would suggest you go back and read the last line of the previous paragraph. Just the stress of being a minority in a predominantly white community is a contributing factor. When I was on the Orange Board of Education a few years back, we had a discussion on expanding Project Choice in our schools, a program that affords inner-city children the chance at a fabulous Orange education. The expansion was rejected along party lines, with one board member, and I quote, saying, "I don't want those kids in our schools." So let's not put our heads in the sand here. Let's all admit we can do better and show our neighbors that not only do we welcome them, but we welcome them with open arms. Again, thank you for holding this forum. Hope to see this on the October Board of Selectmen meeting. Well, that's next week, so that probably isn't going to be. Thank you, Jody Deach. So those are emails that I received that were requested to be read into the forum, and there's still more that needs to be learned about this. And like I said, anybody who wishes to email me, who might have been uncomfortable here, who's watching at home, you can email the First Selectman's office at jzeoli, Z-E-O-L-I, at orange-ct.gov with your thoughts, and they will still be presented when it does get to the Board of Selectmen. Is there anybody else in the audience that would like to speak? Since you've heard me read these and all, no? Attorney Marino asked for it to make a comment.
Yeah, no, having listened to everyone and, I apologize. Having listened to everyone, first of all, I think there should be limited debate on the issue of racism is a problem. Racism is wrong at any level. The narrowing of the issue of racism as a health crisis, as a matter of governance, has a legal significance. And we need to be mindful of that because we don't want to approach an issue and result in unintended consequences. The unintended consequences being that a declaration of a public health emergency can trigger the reallocation of public funds that can be taken away from our education, from our police, or other emergency services. And there is no question, you cannot argue the facts, that minority groups suffer inequities throughout our country. I think tonight I heard a mix between the subject of racism as a health crisis and the general concept of racism. Having had a child just graduate from Amity last year, I am quite familiar with the issues of race at that Amity school system, within the Amity school system, having suffered personally experiences related to racism and to bullying and of things of that nature. So there's no question that the concept of racism is one that should not be shied away from and addressed. But the narrowing of the issue to one of a health crisis, while it is true, because you cannot debate the facts, that as a matter of where you live in this country, your access to health care is impacted. But we have to proceed lightly and cautiously, that we don't want to just jump on a cause that may be popular by movement, because at the end of the day, the unintended consequence of that cause will have an effect on other parts of our community. So I do encourage the conversation, but I encourage a respectful and intelligent and complete conversation, not to shy away from the effects of our fellow countrymen of various colors, but to work toward what every generation in this country should be doing, striving to achieve a more perfect union. And that is work that will never be done, and is work that is not going to be accomplished within our lifetime. But it's our job to continue the effort. So I want to just thank everyone for coming out. I do agree that's an issue, but I disagree that it should be narrowed to the issue of health care, because I think that that will have a legal consequence to which that people are not being cognizant of. Thank you.
Okay, Sean, there's nobody else left outside? They're all set. Everybody in the room, nobody wishes to speak? All set? All set? Oh, never mind. Mitch, go ahead.
I just want to know, we have some guests with us tonight from the different services in the town. I didn't know if they had anything they wanted to add or questions they had that
I
if we're,
asked them.
well, I just want to make sure there's nothing else they wanted to throw out there
I
that
asked
felt was important. Okay.
Adjourned at 7:30. Thank you all for coming out.